This is the Lone Crater YouTube. We hope this video helps.
You start by cleansing the area so active ingredients can work. Once the skin is dry, dispense a pea-size amount, roughly 0.5 ml, directly onto the red blemish. Apply with a clean fingertip or cotton swab and press gently for 5–10 seconds so you get even coverage. You do this first to create a concentrated treatment zone and minimize irritation on surrounding skin. This focused approach increases efficacy while reducing unnecessary exposure. Once the product is on, give it time to penetrate. Wait 3 to 5 minutes so the formula binds to the blemish. You should layer thinner, water-based serums first and place this targeted treatment over the lesion. Finish with a light moisturizer to seal it in. If treating at night, avoid strong acids or retinoids on the same spot to prevent excess irritation. If you treat in the morning, make sure to apply SPF afterward, because active ingredients can increase sun sensitivity. To finish, use the product once or twice daily depending on tolerance, and monitor the blemish over 7 to 14 days so you can detect improvement or irritation. If you see increasing redness, burning, or swelling, stop use immediately and rinse the area. That response indicates sensitivity or an adverse reaction. As a troubleshooting tip, always patch test a small area before restarting, and if the lesion worsens, shows pus, or you get a fever, consult a clinician right away.
Thanks for watching. Consider subscribing if we helped you.